Leicestershire's social care is one of the first to meet the Department of Health's target to introduce electronic social care records. Developed using the Wisdom electronic document and record management system from Morse, Leicestershire is already seeing benefits in improved administration and in its ability to share records securely with fellow service providers.
I think the status of local government work and working as a social worker too often has been seen by the public as drenched in the 1940s or 50s, and you know, we've all got biros on our jackets, and we have old mountains of old files and papers everywhere. And I think this way we're able to present a much more business-like and much more modern kind of approach. And the benefits for people are that we're giving them accurate, up-to-date information in a modern format that's readily available, and I think that people appreciate that.
Previously, every time the phone went, it would generate just another piece of paper. And depending on where that particular service user was within the referral process, there would be a number of baskets that their paperwork would go into. So when the phone went and it was about a case that was open, then we would have to say, well, you know, if you just hold the line a minute, I'll go and get your paper out of whichever basket it may have been in. Or if it was a new case, sometimes we'd have to go downstairs, get a file to see what's happened previously. So now we're in a position where we don't have to do that. So if somebody rings up and I'm on duty, I have available to me straight away the most accurate, the most up-to-date information, and we can work with that instantly. We don't have to put somebody on hold. We don't have to ring them back later. And as a result, yes, it is much more efficient. And you don't feel that sense of frustration as well as a worker that you're having to keep somebody waiting.
The system has made us work smarter, if you like. We tend to be more organised rather than in the old days before ESCR. We'd have lots of bits of paper stuck in the file, we'd have notes of telephone conversations, etc. Now I think the system prompts us to be more efficient in using the system and making sure we write things up as we go along, because we know that somebody in another office or even in the room next door may need to refer to that information, so it needs to be up to date.
When somebody rings up, or when we're actually working on a case, and when somebody's been to the hospital, for example, and has seen a social worker within the hospital team, we can see what happened, what discussion took place with the worker, and we can see that in the case records, whereas previously would have had to contact the hospital, speak to the worker, or ask them to send their papers to us. Also, home care are able to record what's happening on a day-to-day basis in there, that previously we would have had to have had a discussion with the home care workers.
It's much more professional to work with, it's accessible, it's accurate, it's very flexible. And I often work at other bases, and I can be at my other office, I can log in, and I've got absolutely accurate, up-to-date information on a case. I can add information so that people anywhere else in the county can see exactly what's happening without any of the drawbacks of the old paper system.
ESCR's made a big difference to me as a manager. I think even more so than I envisaged. It's not until you actually start working with the system that you see the benefits. Staff are able to ask me advice and authorisation on case management, and I can again respond to that immediately, and they see the response immediately. I think it's helpful that I can cover for other team managers. Again, I don't have to travel to their office, but I can provide that same support wherever I'm located.
Implementation of the electronic social care records with Morse's Wisdom electronic document and record management system was carried out by an in-house team. Integration of Wisdom to other core applications allows service staff to access social care records from their own familiar systems.
I wouldn't say that it's been easy to move to ESCR, but we were the pilot site, and in effect we volunteered to be the pilot site. We'd actually been involved in developing other systems, our assessment tools, so we knew the benefits of having involvement in developing anything that you're going to be working with. So we talked about it, you know, as a team for a while before it actually came on board. I think the important thing was that although there was a framework for developing ESCR, that we had the flexibility of making sure that the system met our needs and our processes rather than the other way around.
The implementation of ESCR, because we were the pilot site, I suppose there were a few sticking points initially, but we were supported very well throughout the pilot period of time. And if there were any changes that we needed to make, we would feed that back, and they were changed fairly quickly. So whilst we, I suppose as a team and personally were a bit anxious about it, it went very well, I think. And so the changes that we made hopefully had an impact on the other teams that got the system later down the line when it was rolled out.
You've got to get your head around things being electronic as opposed to paper, and we've worked with paper for so long, it is difficult to let go. But even people that are perhaps were less IT minded, you know, there was appropriate support to see them through the processes, and they've been great, and they've actually achieved so much for themselves in working with this system. I don't think people would want to go back to paper files.
I was somebody that was really not au fait with keyboards and computers, and I've seen how easy it is to work in a modern fashion, and ultimately I can see the flexibility of people being able to work wherever they happen to be with laptops and so forth. I wouldn't hesitate to recommend to anybody that's a bit dubious about using social care records. I'd say, you know, do it, embrace it, because it's a much more efficient, modern way of working that allows you to work in a more uncluttered and clearer and cleaner way. And for the organisation, I think it's just like chalk and cheese with how we used to work.